I'm going to be telling you today about the three phases of perioperative nursing. The first phase is pre-op, where we bring the patient in and do a little bit of education about post-op initially, so we plan from the beginning to make sure the patient is clear about what's going on and what to expect post-operatively. They will change their clothes into hospital attire, the dreaded backless gown, and then have an IV started. Both anesthesia and the surgeon will come out and get informed consent from the patient to make sure they understand what is going on and that they agree to proceed. At that point, intraoperative nurse will come out. He or she will be asking about fast food or drink. They have allergies to medications. Do they understand what's going on? Any further questions that they had forgotten to ask, and that kind of thing. The patient at that point will be given some Versed or sometime around then and moved to the intraoperative or phase 2. In intraoperative phase 2, the circulating nurse will help with induction of the anesthetic. They're there to kind of support the anesthesia provider, whether it be CRNA or an MD anesthesia, or in some places they have AAs, which is very similar to a physician's assistant, but specializing in anesthesia. We will then prep the patient for surgery with either a chlorhexidine, betadine gel, betadine, some sort of prep agent that is purely based on surgeon preference and the determined site. And at some point before this, we would also do any kind of instrument, sponge, needles, etc. counting that need to be done with our scrub tech or scrub nurse. The circulating nurse is in charge of any type of documentation that needs to happen, just letting them know from a nursing standpoint what's going on, and any type of tracking that needs to be done, so if there's screws, plates, implants, and that type of thing, they need to be recorded and sent to manufacturers to let them know what patients have, what equipment. From there, the patient is woken up once the procedure is done from anesthesia, or begun to be woken up, extubated, and moved into phase 3, which is the PACU, the post-anesthesia care unit. And there you have a nurse, an RN, who is there to support the patient and continue allowing the medications to wear off and then to wake up, making sure that it's done safely, their airway supported, their pain management's taken care of, and that type of thing. Many times the surgeon comes out and talks to the family, and they'll talk to the patient as well, although the patient frequently does not recall this. Once the patient is able to take some fluids, has pain and nausea under control, they can be moved to either, whatever unit they're going to be going to, or discharged home. But this needs to be verified with the anesthesiologist. And that is the main role of nursing for perioperative.